Hello everyone, my name is Kichi McBride of KM Health Insurance Services. In this video, I'd like to talk about the two main Medicare coverage scenarios. When someone turns 65 or someone is retiring from work, they have all these decisions to make. But when it comes to Medicare, they have two main scenarios to keep in mind. I will call the first one the original Medicare scenario and the second one Medicare Advantage scenario. For both scenarios, you will first need to get your Medicare card, and you can do this by contacting Social Security. Once you get that card, check the information in it. So you have to check for your legal name, your Medicare number, and note that the Medicare number has 11 characters and it has an alphanumeric combination, so you will see letters and numbers. Check your Medicare card for Hospital Part A and or Medical Part B. On the opposite side, it should show you the effective dates for each. With the original Medicare route, you are dealing with the federal government. Your Part A covers your inpatient stays or your hospital stays, also skilled nursing facility stays or hospice stays, while your Part B covers medical services such as your doctor's services, preventive services, lab tests, durable medical equipment supplies, and ambulance services. These are mostly outpatient services. So your Part A is mostly for your inpatient services and your Part B for your outpatient services. What Parts A and B don't cover are your outpatient prescription drugs or medications. So after you get your Medicare card, which contains Part A and or Part B, you can add a Part D or prescription drug plan to your coverage. Remember, you must be enrolled in Medicare Part A and or Part B to enroll in Part D, prescription drugs. The Part D plan is your prescription drug plan and it's offered by private companies. Remember, when you visit your doctor in the clinic, you may come home with prescription medications that you pick up from a retail pharmacy, or it can be mailed to your home. A PDP or prescription drug plan covers your outpatient medications prescribed by your doctor. Now, remember that Medicare helps with the cost of healthcare, but it does not cover all the medical expenses. You, as the beneficiary, will have a share of cost. This will come in the form of deductibles, co-insurance, and co-pays. To help you with your cost share, what you can do here is you can also add a Medicare supplement or Medigap. But in order to do this, you will need both Medicare A and B to be in your card. In other words, you have to have both Medicare Parts A and B, not just one of those, so you can purchase a Medicare supplement or Medigap. Now, what does Medigap or Medicare supplement do? Medigap or Medicare supplement insurance helps fill gaps in the original Medicare, and it is sold by private companies. Remember, original Medicare pays for much, but not all, of the cost for covered healthcare services and supplies. A Medicare supplement insurance or Medigap policy can help pay some of the remaining healthcare costs, like co-payments, co-insurance, and deductibles. Now, you have your Part A, Part B, and D, or prescription drugs covered, and you also have your Medicare supplement or Medigap. You still need to keep in mind that there are services that are not covered by original Medicare. Examples are your dental or your routine foot care. These are just some of those examples. But for now, let's just remember that there are services that original Medicare doesn't cover. So if you have original Medicare, you may have to look for a standalone dental, vision, and hearing plans. Overall, those with original Medicare may get their prescription drug coverage, Medicare supplement, and dental, vision, hearing from different private companies. Now, let's talk about a Medicare Advantage scenario. In this case, you will still need your Medicare card with both Parts A and B. In other words, just like your Medicare supplement, you need both Parts A and B, so you can get a Medicare Advantage from private insurance companies. Yes, just like your Part D and Medicare Supplement, Medicare Advantage is also offered by private companies. Medicare Advantage is also known as Part C. You can have a Medicare Advantage or MA or a Medicare Advantage prescription drug, which they also call MAPD. The only difference is that if it's an MA only, they don't have the prescription drug plan, whereas if it's an MAPD, they have the prescription drug plan included. Medicare Advantage combines your Part A benefits, so those are your inpatient or hospital benefits, and then it also have a Part B or doctor services and other outpatient benefits. And most plans include a Part D or prescription drug benefits and other extra benefits. All of these benefits combined, and it's offered by one private company. Some of them does not include prescription drug plans, but they do have your Part A, Part B, and extra benefits, and they are just called Medicare Advantage plans. But once they add the Part D or prescription drug plans, they now call it MAPD or Medicare Advantage prescription drug plans. Some beneficiaries just need the Medicare Advantage plan that does not include the prescription drug plans. A good example would be a senior with a retiree health plan that already includes prescription drug plans. They won't need, or they may not need, a Part D or prescription drug plan that is included in a Medicare Advantage plan, so they may end up just purchasing a Medicare Advantage plans without the prescription drug coverage. So with the original Medicare scenario, you have your Medicare card, the red, blue, and white card. Then you have your prescription drug plan card from one private company, and you can also have a Medicare supplement card from another private company. But when you have a Medicare Advantage or MAPD or Medicare Advantage prescription drug, you will have one card from the private company, and it already includes your Part A and B benefits, your Part D or prescription drug benefits, and other extra benefits. You should reach out to a licensed health insurance agent or broker if you want more information about health plans offered by private companies. You will notice that a health insurance agent or broker may ask you to sign or provide consent to discuss specific plans during a sales meeting. The selections may include Medicare Advantage, Medicare Supplement, prescription drug plans, ancillary products, dental, vision, hearing, and hospital indemnity plans. Well, I hope the scenarios I mentioned in this video will clarify the types of Medicare coverage that may fit your needs. I'd be glad to help you with your questions. Please feel free to call or text me at 301-882-5822 or visit kichimcbride.com to learn more about me.